guys, this is Dr. Teresa Chang. Welcome to my Feel Better About Yourself series. So today I actually want to talk to you about something that I saw a lot when I was practicing regular family practice in my old clinic. What is it? How about my lower back hurts? Really, really common. It was probably the number one complaint of why people came to see me. And we spend billions and billions of dollars on low back pain. So you know what? This is actually just my unique perspective on what you can do at home. And I'm going to teach you some integrated positional therapy exercises that it's actually what I do now, along with access bars, which is a type of energy healing, which actually helps you to feel better, you to clear your mind, clarity, concentration, as well as, muscle balance. So it's really easy. I actually learned it from Lee Albert. He actually has a great book out. It's called Live Pain-Free Without Drugs or Surgery. I learned it from him. He gives classes in Western Massachusetts. So basically, low back pain is, when you have tight muscles that are either too short or too long, and they kind of get the hips out of balance and it gets the spine, out of balance. So let's talk about the hips. So the hips, they're either your hips, they're higher, one's higher than the other, or they're rotated, or they're tilted. So one really important thing to do is to realign, the hips. Because if you think about it, it's kind of like the foundation of your house. The hips are your foundation or the basement. If your foundation is crooked, the rest of the house is going to be crooked. If your hips are misaligned, the rest of everything is going to be misaligned. And it's going to cause pain in other areas, like your neck, like neck pain, shoulder pain. It can even sometimes cause headaches. So it's hips that are misaligned. You also have tight quadriceps. Quadriceps are that big muscle that's in the front of your leg. Here's actually a good example. When you actually have an attack of back pain, right? Like when I had it, what do you do? Everybody's like doubled forward, right? They're all kind of walking like this. Basically, your hip flexors, so flexors are the things that make you bend like that. They're tight. The iliopsoas, so it's a muscle. It's basically a flexor muscle. So that's why everybody's kind of walking like that. That's as technical as it's going to get. Okay, and you also have kind of your legs are rotated, kind of like walking like a duck, and sometimes low back pain is caused by disc problems. Now, let me just tell you, anybody that kind of works with spines will tell you that imaging, like x-rays, MRI, the CAT scans, just because it shows that you have arthritis in your back or, I have a little bit of a bulging disc. Okay, that doesn't necessarily mean that you have pain. And I used to tell that, all the time, because you can actually image a person who doesn't have pain and their discs might look the same. Their x-rays might look the same. So anyway, so we're going to talk about prevention in this actually series. So number one, really, really important is water, right? Like water. Why? Because our bodies are basically made up of majority of water. Cells, water, discs need water, your muscles, your organs, they need water. And you know what? We don't drink enough. You know what? I still need to drink more. I'm not always really good at it. So how much do you need to drink? Basically, it is your weight in pounds, because I actually have friends who use the metric system. Your weight in pounds divided by 2 is the number of ounces that you need to drink in one day. And it's a lot more than most of us are used to. So 160 pounds divided by 2 is 80 ounces. So it's like more than 5, a little bit more than 5 of these. And I'm not saying that, tomorrow you need to go and drink five bottles. You can gradually bring it up. Yes, at first when you drink more water, you got to go to the bathroom more because your body isn't used to, used to all that water. It's kind of like when you have a dry plant, you pour the water and it all comes swishing out. None of it absorbs. You'll really notice the maximum benefit effects like after like 6 weeks. So water. Second one, low back pain is caused a lot by bad posture and ergonomics. So you got to be aware of that. Look, I'm like, leaning in. Bad posture, ergonomics. So basically what you want your hips to be aligned with your shoulders, to be aligned with your head and your neck. So when we're sitting, most of the time we do this. So what Lee Albert says also, you just get, just a cheap flat pillow and you roll it. Doesn't have to be all the way, you just roll it a little bit. And you stick it in behind your back in your lumbar, or the small of your back, your lumbar area. And it allows you to kind of keep everything in alignment, because we can try and sit straight like that, but in half an hour, most of the time, happens to me, we're like crunched over. So use a pillow, and it doesn't have to be those pillows that you buy for your chair, because you know why? Every chair is different and every body is different. So you might as well just use something that you can actually change up yourself. So 2 major culprits when we're sitting is, I didn't mean to do that. Right? Your computer. What's happening when we're at a computer? Most of the time, our hands are all the way out here. You want to keep your elbow right in line there. You want to keep your elbows by the side. So why? Because when you're like this, your hands out, causes strain here, strain here, strain here. You're going to get a headache. You're going to get, strain everywhere, and it's going to be lopsided. So it's just bad. So be aware of it. Just be aware. Yeah, it will mean that you got to move your mouse a little bit closer. You move your keyboard down. What you want to do, you keep your elbows in, and then you got the nice back, because we spend a lot of time at computers, nowadays. So it's going to be a major cause of back pain. And so that leads me to number 2 culprit, which is also driving, right? Like driving like this. So 10 and 2 position is going to be, not so good. So 4 and 8 position, you want to keep your elbows down. I actually changed up the way that my seat, my car seat, and my steering wheel. Nobody really likes sitting in the car seat after I fiddle with it. Pillow in your car seat so you get that nice posture. I raise my car seat up and I kind of bring my steering wheel down to simulate that. Because, even for a car ride, 2, 3, 4, 5+ hours, that will wear. Here's another quick tip, when you're on your computer or when you're driving, if you've kind of noticed that you've been doing this, just shrug your shoulders up for about 5 seconds and then down, do it a few times in a day. That actually will also help to help kind of relax some of those muscles. So water, your posture, sitting, driving, computer. Guys, thanks for checking in to the My Lower Back Hurts series. Stay tuned for the next video. Thanks, guys. Bye-bye.